Great. Good afternoon and welcome to COVID Conversations. Today we're so lucky to have two UF pharmacists with us, and I would like to go ahead and introduce them. We have Dr. John Allen and Dr. Chardaè Whitner with us. We would like to go ahead and do a little bit of background on each of them, a short bio, so that you know who we're talking to and where they're from. So Dr. John Allen is the UF College of Pharmacy's Associate Dean for Diversity, Inclusion, and Health Equity, and a clinical associate professor at the college's Orlando campus. In his current role, Dr. Allen leads the college's Office of Diversity, Inclusion, and Health Equity. Dr. Allen graduated with his Doctorate of Pharmacy degree from Florida A&M University in Tallahassee, Florida. He is dual board certified pharmacist in clinical care and pharmacotherapy. His research interests and professional areas of interest include the use of antibiotics in the ICU and implementation of evidence-based pharmacy, student and faculty diversity programs. So thank you so much for being here. And we also have Dr. Chardaè Whitner, who is a clinical associate professor at the University of Florida College of Pharmacy. She just started working for the university about a year ago in July of 2021. She serves as the Jacksonville campus director for the Office of Diversity, Inclusion, and Health Equity. Her current interests are focused in mitigating health inequities and health disparities in underserved communities, focusing on bridging that health literacy gap and increasing cultural awareness with appropriateness, amongst healthcare workers. And thank you both so much for joining us. We are joining from 3 different cities, and that is sort of the amazing thing that we've been able to do through modern technology and Zoom. So that's really amazing. And I am so grateful that you guys have agreed to do this with us. I think being able to bring information to the community is probably one of the best things that we can do. So thank you again for joining us. And if you guys are ready, I'm ready to ask some questions.
All right.
Absolutely, we're ready.
All right, great. So for COVID Conversations, for those of you that have joined us before, what we like to do is we like to get some professionals to answer some questions for us. A lot of times they're questions that the community is already asking us, or that we are able to see that we're probably going to get those questions soon, just from being out in the community. Question number 1 is if you guys would please talk to us about the COVID-19 variants.
Judy, thank you for having us on the panel today, and looking forward to hopefully an enlightening discussion about COVID-19 and even some of the medications that we use to treat COVID. And so with respect to variants, well, we know that variants are just really mutations that the virus has. And so if we go back to remembering, or at least understanding how viruses work, the job of the virus is to get to the next host, right? And so it does that by mutating and changing different things about it to make it easier to evade the natural immune system. And so sometimes these variants appear, and as they continue to appear, they sometimes make the virus more transmittable. And so that's what can lead to outbreaks. And so, over time, you've probably heard the Omicron variant, the Delta variant. And so all of those variants are just changes in kind of the structure of the virus, just small enough changes where the immune system isn't able to quickly recognize it. And so that can cause how people can get multiple episodes with COVID-19. They may have been infected with one variant, but then they got infected with a later variant, which maybe your immune system is not as familiar with. So.
And I just want to add, variants aren't a new thing. All viruses have variants. I think we've kind of, as a whole, as a population, it seems like it's new. You even have like your common colds that have variants, the flu. So this is the reason why you can catch the cold every year, or you can contract the flu every year, and the reason why we have vaccines for that every year, because it's in hopes to protect you from that new variant. So variants aren't new. It's just, it seems like there is new, and it seems like it's like, well, why is it keep changing? But this is not a new phenomenon of having variants within viruses.
Thank you. That is really actually so important for people to understand. If people are vaccinated, why can they get COVID-19 again?
Yeah, no, that's a good question. I mean, I think one of the things that you know, you'd like to think that you get the vaccine and you never would get the virus. You wouldn't have to worry about it. But unfortunately, that's not necessarily how. And that's true of other vaccines as well. There's no vaccine that's 100% effective at preventing disease. It certainly can reduce the likelihood of it, but also one of the things that's important about this vaccine is that it prevents you from having more severe symptoms if you do happen to come in contact with it. We just talked about variants, and so vaccines are often geared towards particular variants of a virus. And so when we start to see different types of variants emerge, that's where you can see perhaps the vaccine not working as well for certain types of variants.
Great, thank you. Our next question is for someone who does test positive or believes that they have COVID-19, who should seek treatment?
So treatment is generally reserved for our patients who are at higher risk of getting really sick. So when I say really sick, that means hospitalized or having really severe infections. So these are our older adults, those who are age older than 50 years old, those who may have weakened immune systems. Sometimes you can have weakened immune systems by just certain disease states or by taking certain medications. So that's something you would want to talk to one of your healthcare providers about. And then, of course, those individuals who are currently still unvaccinated, they are at a higher risk of contracting like severe COVID-19 illness.
One of the things that I'll add as well is kind of some of the evidence now suggests that, like, if you're asymptomatic, you don't have symptoms. Let's see, so that scenario where you have a positive test, but the patient feels fine and is not showing any outward signs of COVID. Treatment there really depends on how long you've been, if you don't have symptoms, then you're generally recommended not to start treatment in those folks because the benefit doesn't outweigh the risk, and any drug has side effects, right? And so it doesn't outweigh that. But if you do have symptoms, the thing that we're most often concerned about is when did the symptoms start, right? And how severe are the symptoms, because that'll dictate what drugs are available or what drugs do we use. And so generally speaking, the earlier the better in terms of seeking. Once you have symptoms, the earlier you seek treatment, the better, because there's perhaps more options that are available to you.
Excellent. And I think Dr. Whitner made a great point that I would like to reiterate, which is even if you are not vaccinated, those people can seek treatment. So it's important if you test for COVID-19 that you talk to your medical professional. That's great. Thank you. All right. Our next question really then is about treatments. What treatments are available now for people who get COVID-19?
Well, I'll just hit the highlights here, and then Dr. Whitner, I'm sure, will jump in as well. But one of the things that when the vaccine, or excuse me, when COVID first came out, we really didn't have any therapies, right? And so there was a lot of hand washing, mask wearing, things of that sort. And while those things are still effective in terms of reducing transmission, we're fortunate enough to now have therapeutics that can be helpful. And so some are available on an outpatient basis or available just by getting a prescription from your doctor and going to a local community pharmacy. And the most common, or the most one that's been out recently, is Paxlovid. And so that's available, again, getting a prescription from your doctor and just taking it to any local community pharmacy and having that filled. There are some others that are more hospital based, and you may have heard about remdesivir is one, but that's largely used on the inside the hospital. Hopefully folks don't get sick enough to where they need to go in the hospital, but that's something that we would use. And then another group of drugs that folks may have heard about are monoclonal antibodies. And those are largely, again, provided as an infusion, but they're largely require you to go to an infusion center on to get treatment. So Paxlovid is really the first oral treatment that patients have that can be helpful. There's some things about it that certainly the audience needs to know about, but I'll just hit on one, and then I'm sure Dr. Whitner hit on some others, but the earlier the better. All right, so if and we talked about that with regards to symptoms, if you present 5 days or less from symptoms, that's when you're a candidate for Paxlovid. If you present after that, if you get a prescription after 5 days, then the drug is not going to be as effective for you. And so that's something to be thoughtful about if you start to have symptoms of COVID.
Yeah. And so thank you for that, Dr. Allen. So that is the common medication that we're seeing currently in the community pharmacy. Dr. Allen outlined, when we should seek treatment for this. It is right now under emergency use authorization, so it's technically not FDA approved, but we have seen that this works in treatment of COVID. Right now it's used in adults and children's age 12 years and older, so we do want to make sure you're aware of that as well too, because children still can catch COVID or get COVID. And so you can't use it for our younger ones. Remdesivir is another treatment that has that emergency use authorization. So Paxlovid and remdesivir are our most recommended treatment options. This is also an antiviral treatment as well that we use on the inpatient side. It's given through IV infusions. You have to do it at a healthcare facility for 3 days. And again, it's like Dr. Allen said, as soon as possible. So once you start presenting those symptoms and be tested positive, you want to begin within like 7 days of having symptoms there. Another thing Dr. Allen also mentioned is monoclonal antibodies, and these just work a little bit differently from the Paxlovid and the remdesivir, as it's kind of like all of our bodies have antibodies where it fights off infections, but sometimes our bodies just don't have enough like little soldiers in there to fight off those viruses. And that's kind of what the monoclonal antibodies are used. Those are like a single injection. You have to get that from your healthcare provider as well too. So none of these things can be picked up off the shelf or just at your own leisure. That you do have to see a healthcare provider, test positive for COVID-19 in order to receive these treatments.
Okay, great. So I hear you saying see your doctor first, right?
Yeah.
Yes.
Okay, go ahead, Dr. Allen.
And one thing I was going to add to that, and you teed me up quite well, is particularly with Paxlovid, there's some things about this drug that you need to go see your doctor about and get a better understanding of whether it's the right drug for you. So for instance, like if someone has renal disease where their kidneys aren't working as well, Paxlovid might not be the best option for that patient. Also, if a person is on a lot of prescription medications, Paxlovid may not be the best option because there's some drug interactions with Paxlovid. And so as you've mentioned already, go talk to your medical professional, your doctor, to understand if this is the right drug for you, and so that they can evaluate those things. And it may still be the best for you, but at least you want to make sure that you bring all the information to your doctor.
Oh, that is really, really good. Can either of you speak to what Paxlovid rebound is?
Sure. So what we're seeing now, this is kind of new information that we're getting from the CDC. Some patients are experiencing like a return of symptoms after they finish treatment of the Paxlovid, and it could be common, and it just could be like the virus just kind of finishing off, I would say, for lack of a better word. And so you can have these symptoms regardless if you're vaccinated or not. But it's generally mild illnesses, so that we know that the Paxlovid is still working at treating the virus. And there hasn't currently, like I said, there's not much information out there because it's kind of a new report. But right now, they haven't seen any severe diseases with the rebound, or COVID rebound is what they're calling it. So no worries, shouldn't be any two concerns about the return of symptoms. They're generally mild.
Yeah, and just, I mean, with any disease course, particularly, influenza or any type of infectious diseases, sometimes symptoms wax and wane. And so it's not uncommon for that to happen. But to Dr. Whitner's point, right now, that's not suggesting that the drug isn't working. That's just one of those things that it's kind of almost the natural disease course. You can see some symptoms return.
Okay. Our next question is, are there any over-the-counter medications that can help us manage COVID-19 symptoms if we don't need to go to the doctor and get a prescription?
Yeah. So of course, this is just symptom relief. This is not treating COVID-19. So some of the symptoms that we've seen with COVID are like fever and body aches, maybe some runny nose and congestion, some sore throat, vomiting, nausea, diarrhea. So there are treatment options for symptom relief. I just want to make sure we are clear that it's symptom relief and not actually treating the COVID virus. So some of the common things for like fevers and body aches, or some of our pain relievers are fever reducers, I would say, like Tylenol, Motrin, Advil. Of course, you want to take these with caution as well, depending on any type of disease states you have. Like Dr. Allen mentioned with the Paxlovid, if you have like renal issues, or those, we would err on the side of caution, especially with the Motrin and Advil. Things for like nasal congestion or those runny noses, or some of the same things that we use for like allergy medication. So like normal saline, the nasal saline spray, some of our allergy medicines like Claritin, Zyrtec, or Allegra are some of the common ones, or the store equivalents as well. They work just as well. Some decongestants like pseudoephedrine, of course, you want to use that with caution as well, especially a lot of our older individuals will have higher blood pressure. So it's generally not recommended for those individuals with higher blood pressure as well. And then like that nausea and vomiting. So some of the same things of like Pepto-Bismol, but of course that also comes with making sure you speak with your doctor about if you're able to take that, depending on some medical conditions that you have. But it is really important to not like just go out and treat your symptoms. You want to make sure you are confirming that you have COVID-19, so you can take the correct measures to ensure that you're distancing yourself from your loved ones or coworkers or whoever it may be. But all of these medications, that are recommended for symptom relief, they should be discussed with one of your healthcare providers. Since it is over the counter, you can always speak with one of your pharmacists to determine if this is the best solution for you.
So of course, my next question is, can supplements play any role in preventing COVID-19?
Well, I mean, I think from a supplement standpoint, certainly they can be helpful in terms of your immune system and just overall vitality. But with respect to preventing COVID, there's not any evidence that supplements themselves can prevent one from getting COVID-19. The other thing, with supplements is you need to be mindful that sometimes they interact with certain medications as well. And so as we talked about with some of the prescription medications, it's not a bad idea to, if you're in the pharmacy, to talk to your pharmacist about the medications that you're on and saying, if you want to start a supplement, hey, does this interact with any of the medications I'm taking? As a general best practice, even outside of COVID, I think that's a good practice to have. But with respect to supplements actually preventing COVID, right now, the evidence doesn't suggest that there's any supplements that are helpful.
Great, thank you. What is the best way to prevent COVID-19?
So, I mean, kind of what we did at the start of the pandemic, continue doing those same practices, isolating yourself if you're sick, or, you know, making sure you cover your mouth if you're coughing, or staying away from someone who is, you know, coughing, remaining at distance. Wearing a mask, especially if you're unvaccinated, is still recommended to wear a mask. Even if you are vaccinated, you can wear a mask at your own choice. So those are some great ways to prevent COVID. You know, one of the best ways to prevent COVID or the spread of COVID is making sure we get tested. You know, awareness is a big way to kind of reduce that transmission. And we can have at-home tests. You know, the United States government, they created a little bit more accessibility to determine if you have COVID-19 or not. They provide a free at-home COVID test, and that could be obtained at www.covidtest.gov. It's very simple form. It's asking you your information, your address, and that's it, and it's mailed to you within a couple of weeks. Or you can obtain these tests from your local health department as well. So that's one of the increase we are the most way that we can prevent the spread of COVID-19.
And if I may add, you know, I think, you know, in terms of awareness, right, just being alert to the symptoms as well, right, and not immediately dismissing them as something else, right? Maybe that's just allergies, or when in doubt, you know, as Dr. Whitner mentioned, you know, there is testing that's available to folks now. You don't necessarily have to go to your doctor's office to get tested. I know that was kind of how it was in the beginning of the pandemic. You had to go get tested in either a drive-through line or go into your doctor's office. Now it's a lot easier to do this at home. The other thing, I would be remiss if I didn't highlight the need to get vaccinated if you're not already vaccinated, and just continuing to stay up to date with the COVID-19 vaccine, in terms of, if you do get it, then it will be less severe. And so I encourage folks to get vaccinated, and talk to their health professional if they have any questions about vaccination.
Awesome, thank you. And so we are at our last question, and I think you guys have covered so much, and I really appreciate it. Our last question is this: if you would each just take a moment and tell us what else you wish people knew in regards to COVID-19 or vaccines or treatments that are available.
I guess I can start off. So, I mean, COVID-19 is still very much real. You know, we've seen a lax of some of the requirements of like masking and allowing more social events, but it still is real, and it's still, it could be an increased risk of severe COVID-19 infection, especially for unvaccinated individuals. So just kind of staying vigilant about being, you know, protecting yourself as well. So and still implement those safe practices. Like I said, mask wearing, especially if you're unvaccinated, and if you are vaccinated, you can wear masks as well in large crowds. Washing your hands, and, you know, cleaning surfaces. Those are typically great practices with any virus, as we mentioned earlier. But I want us to remember, you know, because we're seeing a decrease in hospitalizations, which is great, and we can account that for vaccinations. I mean, we've had over 500 million people vaccinated in the United States alone, and 200 million who's been fully vaccinated. So we're seeing decrease of severe illnesses due to the vaccine, but still staying vigilant and making sure that you're practicing, you know, safety and with caution.
Yeah, and I would add to this, our audience is older adults, and so one of the things that I think is important for folks, if we're talking about vaccination, is that the data tells us that Pfizer, Moderna, it doesn't really matter in the long run, but either of them show 94% reduction in the risk of serious COVID-19 related hospitalization. Think about that. If you didn't know anything about a drug and they said this reduces your risk of being in the hospital by 94%, would you take it? And I would say in this case, it certainly is warranted because we know that once you're hospitalized with COVID, there are other things that happen down while you're in the hospital, right? And so there's a higher risk of worse outcomes if you're hospitalized, right? And so the vaccine is that effective. If we have a tool that's that effective at reducing the risk of serious hospitalization, I would encourage the listeners and viewers to, if they're not already, please talk to your health provider about getting vaccinated. It might make a difference for you or some of your loved ones. So encourage you to think about getting vaccinated.
Well, thank you guys so much. Again, Dr. Allen, Dr. Whitner from College of Pharmacy at UF, Office of Diversity, Inclusion, and Health Equity. I want to thank you both so much for your time. This has been amazing information that I know we get a lot of questions about, and I'm grateful that you guys spent some time with me today to answer those questions.
Thank you for having us.
Thank you. Our pleasure. And we'll be back anytime you're ready to have us back.
Yes.